Welcome to Learning Anatomy with Dr. Bakare. In this lecture, we'll be looking at elbow anastomosis. This is where we have the elbow, and within this region is where we have the creation of the elbow anastomosis. This anastomosis is formed by branches from the brachial artery. This is where we have the brachial artery here, arrowed in blue, and we know that the brachial artery will finally divide into the radial artery and also the ulnar artery. We also have contributory supply or branches emerging from these two arteries. So we say we have branches from the brachial artery, and these branches are directed inferiorly towards the elbow, where they are seen to provide collateral branches. Well, we also have the final terminal branches of the brachial artery, which include the radial and also the ulnar arteries. These two arteries are also seen to give their contributory branches to the creation of this anastomosis. And these branches are basically directed upward, and this is why they are seen to provide recurrent branches. So we have recurrent branches from the ulnar and the radial artery, while we have collateral branches from the brachial artery. So both the collateral branches and also the recurrent branches are seen to network themselves around the elbow, and this is where they are seen to create the elbow anastomosis. So write down with me in this lecture where I'll be describing the details behind the formation of this anastomosis. That elbow anastomosis is an arterial network that provides extensive supply to the elbow. And this is basically as a result of the fact that we have a number of branches from different arteries coming together to create this anastomosis. And this is where we have its creation here around the elbow. Elbow anastomosis basically provides alternative pathway or blood bypass in case of blockages. So when we have blockage in one artery, blood will still be able to reach this artery through other arteries that are connected to it. And this is the essence of the creation of this anastomosis. So this anastomosis, basically, we say that it is formed by branches from the brachial artery, which of course we say that this artery will create collateral branches that are seen to descend inferiorly. And this is where we have the brachial artery here, arrowed in yellow. We know that the brachial artery will finally terminate into the ulnar and also the radial artery. So this anastomosis also is seen to be formed by branches from the ulnar artery. And this is where we have the ulnar artery here, arrowed in green. We know that the ulnar artery is one of the terminal branches of the brachial artery. And this artery is seen to provide recurrent branches that are seen to be directed upward. We also have another branch that also contributes to the formation of elbow anastomosis. And this is the second terminal branch of the brachial artery, and this is the radial artery. This is where we have the radial artery here, arrowed at this lateral side. So this radial artery also is seen to contribute its recurrent branches, which of course are seen to be directed upward. So we see that the collateral arteries that emerge from the brachial artery are directed downwards, and this is where they are targeting the elbow because these branches emerges above the elbow. So they are directed downwards where they can finally reach the elbow region, where they will contribute to the formation of this anastomosis. We also have branches from the radial and also ulnar arteries that are seen to be directed upward. We say that these arteries are recurrent branches, and you see that they are targeted upward so that they will be able to reach the elbow region because their emergence is below the elbow. So you see that in the formation of the elbow anastomosis, the different arteries that gives off their branches, whether positioned superiorly or inferiorly to the elbow, are seen to be directed accordingly so as to reach the elbow region. And this is where they contribute to the formation of elbow anastomosis. So in summary, we'll be having a total of 4 key points where anastomoses are created around the elbow. There is an additional transverse anastomosis that is created, and this will be highlighting as we go through with this lecture. So if we try to put this image in its correct anatomical position, this is where we have the medial side, and this is where we have the lateral side. And it is important that we highlight the specific regions of the distal part of the humerus where these anastomosis are created. We know that at the inferior region of the humerus, we have an expansion that is referred to as the epicondyle. Around the medial side here is where we have the medial epicondyle because it is located medially. While on this other side, we have the lateral epicondyle. This is used as a landmark onto which this anastomosis are created. So if you go to the anterior region of the lateral epicondyle, we have an anastomosis created at this point. If you also go behind the lateral region of the lateral epicondyle, we'll be having another anastomosis created. Then if you go to this medial side in the anterior part, we have the third anastomosis created, while behind the medial epicondyle, we also have another anastomosis created. So in totality, we have 4 anastomosis created around the elbow joint, whereby the medial and the lateral epicondyle are used as the landmark. It is also important that we have that there is an additional transverse anastomosis that is created around the olecranon fossa, and this is around the posterior region. We'll also be expatiating more on this as we go through with this lecture. Now let's drive further with this lecture, where we'll be going into the details on how these anastomosis are created. First, let's look at the brachial artery. We know that the brachial artery is the sole artery that is responsible for the creation of elbow anastomosis. We know that this brachial artery, even though it will finally terminate, the branches that it finally terminates into, we also be providing recurrent branches that would help in the creation of formation of elbow anastomosis. The brachial artery basically is an arterial supply of the upper limb, and it is seen to begin from the inferior border of the teres major. It is a continuation of the axillary artery. If you try to use this image at this upper region, this is where we have the teres major, and above the teres major here that is highlighted in green is where we have the axillary artery. Just around the inferior border of this teres major, we have the continuation of the axillary artery, and at this point it will be referred to as the brachial artery. So this is where we have the emergence of the brachial artery, specifically at the inferior border of the teres major. And this is what is highlighted here at this point. This brachial artery is seen to pass through the medial bicipital groove. If you try to use this image at this upper region, this is where we have the biceps brachii in the anterior part, and behind it here we have the triceps brachii. So in between the biceps and also the triceps, around the medial side, we have a topographical indentation that is referred to as the medial bicipital groove. Because we have a medial bicipital groove, we should expect to have a lateral bicipital groove, and this will be seen around the lateral region. But specifically, we are focusing on the medial bicipital groove that is located around the medial side, because this is the groove that accommodates the brachial artery after its emergence from the inferior border of the teres major. So you see it passing through this groove, and this is what is highlighted or harrowed here in blue. So after passing through this groove around the medial side, it is then seen to change its orientation to its anterior region. So this is where it moved from its initial medial path to finally be directed anteriorly. And upon its anterior path is where it finally enters into the cubital fossa. We know that the cubital fossa is a triangular depression that is located in the anterior region of the elbow. And of course, this is located in the anterior region. But after its initial part of its medial course, it is finally seen to be directed anteriorly, so as to have access into the cubital fossa. If you try to use this image at this lower side, this is where we have the brachial artery, and you see that at this point, it is initially running a medial course before it is finally directed anteriorly. And this is how it passed down inferiorly to enter into the cubital fossa. So within the cubital fossa, the brachial artery is seen to finally terminate just around the neck of the radius. So let's try and put this image in its correct anatomical position. This is the medial side and this is the lateral side. And this is important for us to easily establish the different arteries that the brachial artery will finally terminate into. On the lateral side, we have the emergence of the radial artery. Don't forget that the radius is located laterally. So we should expect that the radial artery also will be positioned around the same region. Well, on this medial side, we have the ulnar artery. Of course, we know that the ulnar bone is also positioned medially. So we should expect that the ulnar artery will also be located in the same region. So you see that we have 2 terminal branches of the brachial artery. And we already highlighted that branches from the brachial artery will descend inferiorly to target the elbow, and these branches are solely collateral branches. We also have branches from the radial and also ulnar arteries that are directed upward, which are basically recurrent branches. So we have the collateral branches coming from the superior region and the recurrent artery coming from the inferior region. And the two arteries will merge or unite in the creation of anastomotic network around the elbow. And this is the basic behind the formation of elbow anastomosis. So this is a summary of the brachial artery on how they emerge and finally how they terminate. So now let's dive into the branches of the brachial artery, where we'll be highlighting the specific path through which they run and also their final path in accessing the elbow, where they will be creating this anastomosis. So using this image, this is where we have the brachial artery, and this brachial artery is seen to have a number of branches. It is seen to have the profunda or the deep brachial artery, and this is what is harrowed there at this point. This is a posterior emergence of the brachial artery, which means that it is seen to emerge around its posterior region. Then we have the superior ulnar collateral artery, and this is what is seen to be harrowed there in green. It is seen on the medial side, and of course it is superiorly placed. Then inferior to this artery, we have the inferior ulnar collateral artery, which is also seen on the medial side, of course located inferior to the superior ulnar collateral artery. And this is what is harrowed here in blue. The brachial artery is seen to give off a number of muscular branches, and this is what is highlighted here in this image. Then we have the nutrient artery of the humerus, which of course provides the arterial supply to the humeral bone itself. Then finally, the brachial artery will descend inferiorly to terminate into two branches. We've already highlighted this previously. This is where we have the radial artery that is harrowed here in black on the lateral side, and on the medial side we have the ulnar artery that is also harrowed here in black. We already highlighted this in our previous slide. So if you look at all the branches of the brachial artery, the first three branches that is highlighted here at this upper end are seen to provide collateral branches. We say that these collateral branches are seen to descend inferiorly because if you look at how these branches emerge, you see that they emerge above the elbow. And since they will be contributing to the formation of elbow anastomosis, there is the need for them to descend to that region where this anastomosis will be created. And this is where we have the collateral branches descending inferiorly, of course, targeting the elbow region, while we have the final terminal branches of the brachial arteries, which are the radial and also the ulnar arteries. If you look at these two arteries and also how they emerge, you see that they emerge inferiorly to the elbow. This is why we say that this will provide recurrent branches that will also be directed upward. And they are directed upward because they will need to access the region of the elbow, where they will be contributing to the formation of this anastomosis. I hope this is understandable. So let's drive further, where we'll be highlighting the first branch of the brachial artery, which is the profunda or the deep brachial artery, and also highlighting how this artery contributes to the formation of elbow anastomosis. Now let's look at this artery. We say that the profunda or the deep brachial artery is the first and the largest branch of the brachial artery. It is a posterior emergence, which means that it is seen to emerge around the posterior region of the brachial artery. If we use this image on this other side, this is where we have the profunda or the deep brachial artery. You see that this artery is seen to emerge around the posterior region. It is seen to run through the triangular interval before it is finally seen to pass through the radial groove. Let's use this image on this other side to illustrate the triangular interval. This is where we have the triangular interval here highlighted in yellow. This triangular interval is formed by muscles that of course are arranged in a triangular pattern. And this is why they create this triangular allowance around the posterior region. This triangular interval is formed medially by the long head of the triceps brachii, while on the superior part here, it is bounded by the teres major muscle. On the lateral side, it is bounded by the lateral head of the triceps brachii. While in some tests, the lateral border is stated to be bounded by the upper region of the shaft of the humerus. So if you look at this arrangement, you see that it creates a triangular pattern of allowance. And it is through this allowance that the profunda or the deep brachial artery will access the posterior region of the arm. It is not seen to pass through the triangular interval alone. It is seen to be accompanied by the radial nerve. This is where we also have the radial nerve here highlighted at this region. So you see that after exiting the triangular interval, they are seen to then pass through the radial groove. If you use this image by this other side, this is where we have the radial groove, which is also referred to as a spiral groove. This groove is seen at the posterior surface of the humerus, and it is along this groove that the profunda or the deep brachial artery will run through. And after this course, it is finally seen to divide into the radial collateral artery. This is where we have the radial collateral artery here in this anterior region. It is also referred to as the anterior descending branch because it is seen to cross through the anterior region. While on this other side behind, we have the middle collateral artery, which is seen at the posterior part. This artery can also be referred to as a posterior descending branch because it is seen to cross behind the humerus. So you see that after it's exiting the radial groove, it is finally seen to subdivide into two branches. And this is where we have one coursing through the anterior part, which is referred to as the radial collateral artery, and the other one coursing behind, which is referred to as the middle collateral artery. So these two arteries are then seen to descend inferiorly. And if you drive deep through the names of this artery, you see that they are collateral branches. They are collateral because they are seen to descend down towards the elbow, where they will be seen to connect with the recurrent branches in the creation of elbow anastomosis. So let's see the recurrent branches that these collateral branches will be creating anastomosis with. So for the radial collateral artery, that is also referred to as the anterior descending artery because it is located in the anterior region, it is seen to be creating anastomosis with the radial recurrent branch of the radial artery. So going back to this image, this is where we have the brachial artery around the elbow. And if you try to place this image in its correct anatomical position, this is the lateral side and this is the medial side. We say that this brachial artery will finally terminate into the radial artery on the lateral side and also the ulnar artery on the medial side. So this is where we have the emergence of the radial recurrent branch, which of course is an emergence from the radial artery. This radial recurrent artery is seen to be directed upward, where it will unite with the radial collateral artery to form anastomosis around the anterior region of the lateral condyle. And let's look at the second terminal branch of the profunda brachial artery, which is the middle collateral artery. We say this artery can also be referred to as the posterior descending artery because it is seen to descend around the posterior region. This middle collateral artery, if you drive through the name, you see that it is a collateral branch, which means that it will be needing a recurrent branch for it to create its anastomosis. The middle collateral artery will be creating anastomosis with the interosseous recurrent artery. Now let's drive through where we'll be unfolding the details on how the interosseous recurrent artery emerges. Don't forget that this is where we have the ulnar artery around this medial side where this arrow is pointing. From the ulnar artery, we have the emergence of the common interosseous artery. This is the common interosseous artery here that is arrowed in yellow. It is seen to be directed towards the interosseous membrane. Don't forget that the interosseous membrane is a fibrous tissue that connects the radius and also the ulna. And this is what is arrowed here in red. So this interosseous membrane is what creates the landmark onto which the common interosseous will be subdivided. So we have the common interosseous then further subdivided into the anterior interosseous artery and also the posterior interosseous artery. While the anterior interosseous artery is positioned anteriorly to the interosseous membrane, the posterior interosseous artery is positioned posteriorly to the interosseous membrane. So this is where we have the anterior interosseous artery that is seen to be located anteriorly to the interosseous membrane. While behind the interosseous membrane, we have the posterior interosseous artery. So it is from the posterior interosseous artery that we have the emergence of the interosseous recurrent artery. And this is what is arrowed there at this point. So this interosseous recurrent artery is seen to be driven upward, where it will finally be uniting with the middle collateral artery. Don't forget that the middle collateral artery, we already highlighted that it is directed posteriorly because it is a subdivision of the profunda or the deep brachial artery. And as one of the terminal branches of this artery, it is seen to be directed posteriorly. where we have the radial collateral artery directed anteriorly, and this is why it is creating anastomosis around the anterior region of the lateral epicondyle. We have the middle collateral artery directed posteriorly. So we should expect that the middle collateral artery will be creating anastomosis around the posterior region of the lateral epicondyle. And this is basically because it is seen around the posterior part. And the artery that it would be creating anastomosis with also is positioned or directed posteriorly. And this is where we have the emergence of the interosseous recurrent artery, which of course is an emergence of the posterior interosseous artery. Don't forget that the posterior interosseous artery is seen behind the interosseous membrane, which of course is directed posteriorly. So an emergence from this artery, which is the interosseous recurrent artery, is what will be creating anastomosis with the middle collateral artery, still around the posterior region. So you have another anastomosis created around the lateral epicondyle, but at its posterior region. So in summary, for the profunda or the deep brachial artery, we have two anastomosis created by this artery through its branches. Don't forget that this is the lateral region and this is the medial side. So it is around the lateral side here that we have anastomosis created by the profunda or the deep brachial artery. So the first one is created here, and it is seen to be created in the anterior part or anterior region of the lateral epicondyle. And it is specifically between the radial collateral artery and also the radial recurrent branch. The radial collateral artery is a branch from the profunda or the deep brachial artery, while the radial recurrent artery is a branch from the radial artery. So you see that one is a collateral that is coming from a branch of the brachial artery, specifically from the profunda or the deep brachial artery, while the other connection is provided by a branch from the radial artery, and this is through its radial recurrent branch. The second anastomosis is seen behind the lateral epicondyle, and this is created between the middle collateral artery, which of course is a branch of the profunda or the deep brachial artery, and this is then connected with the interosseous recurrent artery, which of course is an emergence from the posterior interosseous. The posterior interosseous is an emergence from the common interosseous, which emerges from the ulnar artery. We've tried to describe this previously in details. So you see that we have two anastomosis created by the profunda or the deep brachial artery around the lateral epicondyle, where one is positioned anteriorly, the other one is located behind. And we've tried to describe how this artery is run in being able to create this anastomosis at the specific regions. Now let's drive through the superior ulnar collateral artery. The superior ulnar collateral artery is the second branch of the brachial artery. This is where we have the superior ulnar collateral artery that is harrowed in green. This artery is seen to emerge around the medial side. Don't forget that the profunda or the deep brachial artery is a posterior emergence, so it is seen to emerge at the posterior region. Around the medial side is where we have the emergence of the superior ulnar collateral artery. This artery is seen to originate around the mid shaft region, and it is seen to create anastomosis with the posterior ulnar recurrent artery. So now let's see how the posterior ulnar recurrent artery emerges. This is where we have the medial side, and this is where we have the lateral side. It's always important for us to place this image in its correct anatomical position so that it will be easy for us to understand the arteries by the time we begin to describe them. So around this region, there we have the medial epicondyle, while on this other side is where we have the lateral epicondyle. Don't forget that in our previous slide, we already described the two anastomoses that are created around the lateral epicondyle. One is created at the front and the other one is behind it. And this is solely from branches of the profunda or the deep brachial artery. So on the medial side, let's try and highlight anastomosis also that are created around this region. So we say that the superior ulnar collateral artery will be creating anastomosis around the medial epicondyle, but specifically it will be creating its own anastomosis around the posterior region. So let's see how this anastomosis is created. We say that the superior ulnar collateral artery will unite or communicate with the posterior ulnar recurrent artery. Don't forget that we say that the ulnar artery is on the medial side. So this is where we have the ulnar artery. From the ulnar artery, around its anterior region, we have the anterior ulnar recurrent artery, and this is what is harrowed in black, where around the posterior region, we have the posterior ulnar recurrent artery. This posterior ulnar recurrent artery is around the posterior region, and it is seen to be driven posteriorly, of course, running behind the medial epicondyle. From this region is where it's able to communicate with the superior ulnar collateral artery. And at this point, it is seen to be creating an anastomosis with it. So this is why we say that the superior ulnar collateral artery, even though it's the anastomosis that it will be creating is around the medial side, it is specifically around the posterior region. And this is because of the path by which the arteries, of course, runs. From the superior ulnar collateral artery, descending down, you see it descending behind the medial epicondyle. And also the posterior ulnar recurrent artery that emerges from the ulnar artery, it is also seen to be directed behind the medial epicondyle. So it is at the posterior region of the medial epicondyle that this network is created. So we have the creation of the anastomosis around the posterior region of the medial epicondyle. And this is the third anastomosis that is created. Now let's drive through the inferior ulnar collateral artery. Let's see where it will be creating its own anastomosis. The inferior ulnar collateral artery is located inferior to the superior ulnar collateral artery, and it's seen to emerge about 5 centimeters above the elbow joint. And this is what is harrowed in blue. So we say that this inferior ulnar collateral artery, of course, will be descending inferiorly because it is a collateral branch. Don't forget, we already highlighted this in details, and this is where it will be communicating or connecting with a recurrent branch. So let's see how this also goes. So from the inferior ulnar collateral artery, first, we have two emergence. We have one spiral branch that runs behind the humerus. And this is what is harrowed there at this point. So you see it running and, of course, coughing behind the humerus. And this is where it is seen to create an arc. And as it is directed laterally, it is seen to be creating an anastomosis with the middle collateral artery. Don't forget that we have a middle collateral artery around the posterior region, which of course is an emergence of the profunda or the deep brachial artery. If you go back to the first branch of the brachial artery, which is the profunda or the deep brachial artery, we already highlighted that terminally divides into the radial collateral artery and also the middle collateral artery. This middle collateral artery, we say that it is located around the posterior region. So this is how it packs behind the humerus. And we already highlighted that on the lateral region, it will be creating an anastomosis with the interosseous recurrent artery, which of course is at the posterior region of the lateral epicondyle. This same middle collateral artery will also be creating an anastomosis with the spiral branch of the inferior ulnar collateral artery. And this is where we have the additional transverse anastomosis that is created. Remember, we highlighted when we started this lecture that we have 4 key points where anastomoses are created with an additional transverse anastomosis. So this transverse anastomosis occurs between the spiral branch of the inferior ulnar collateral artery that is seen to spiral around behind the humerus to meet with the middle collateral artery. So at this point, just around the region where we have the olecranum fossa, it is seen to be creating a transverse anastomosis around this region. So this is an additional anastomosis that is created while the other branch of the inferior ulnar collateral artery is seen to descend inferiorly. And of course, it's seen to pass through the anterior region of the medial epicondyle. And this is where to be creating an anastomosis with the anterior ulnar recurrent artery. So using this image, let's try and explain how this connection is created. This is where we have the second branch of the inferior ulnar collateral artery that descends down towards the elbow. And we should expect that this artery will be creating an anastomosis with a recurrent branch. So let's see the recurrent branch and also how this branch emerges. So if you go back, this is where we have the ulnar artery. Don't forget that we have the posterior ulnar recurrent artery. Then we have the anterior ulnar recurrent artery. Don't forget that the posterior ulnar recurrent artery is directed posteriorly. And this is what creates anastomosis with the superior ulnar collateral artery. We already described this in our previous slide where we try to highlight the third anastomosis that is created behind the medial epicondyle. So in the anterior part, we have the anterior ulnar recurrent artery that is seen to be directed anteriorly around the medial epicondyle. And this is what unites with the other branch of the inferior ulnar collateral artery. And this is where they are seen to create the fourth anastomosis around the anterior region. So you see that in totality, we have 2 anastomoses created around the medial epicondyle. While one is created in the anterior part, of course, receiving contribution from the inferior ulnar collateral artery, the other anastomosis is created behind the medial epicondyle. of course, receiving contribution from the superior ulnar collateral artery. So you see that these anastomosis are strategically positioned just around the epicondyle. So this is where we have the fourth anastomosis created, of course, seen at the anterior part or region of the medial epicondyle. And we know that this fourth anastomosis is a network created between the inferior ulnar collateral artery and also the anterior ulnar recurrent artery. And also, do not forget that we have an additional anastomosis that is created around the posterior region of the humerus. This is specifically seen around the olecranon fossa. Of course, it is formed by the spiral branch of the inferior ulnar collateral artery and also the middle collateral artery, which of course is a branch from the profunda or the deep brachial artery. So in some tests, you may see it as 5 anastomotic points, while in some tests, you may see it as 4 anastomotic points. So thanks for watching this video. Bye.